Hi, I'm Garrick, and this is my prezi on what I learned in HS 410 Issues in Aging and how I will use it in my career path of physical therapy. On to the first thing, which is teamwork. Teamwork is working together to get the job done. It is also putting the group's interests ahead of your individual interests. Teamwork is willing to do your best regardless of who gets credit and support your teammates and do what it takes to succeed. As a physical therapist, I will use this strategy with my coworkers to successfully get the job done proficiently. One thing I learned about is power of attorney and my living will. Power of attorney is giving broad power to a person of your choosing to act on your behalf when you are unable to. As for the living will, it doesn't necessarily relate to your dying wishes. It relates to your living wishes. That's why it's called a living will. A living will is for when you are incapacitated or unable to make decisions and you have written down what should be done if this happens. This helps everyone know what you want when you are incapacitated. I will use this information to inform people, and it is just good to give out in the healthcare field. On to getting old. I interviewed Pete, a regular at a local bar, and asked him what the hardest part is when getting old, and his answer was acceptance. But the best part of getting old was the knowledge and wisdom you obtain over the years. Oh no, this person flatlined. We need to get him help. Oh, good, we brought him back. Which brings me to the next topic, medications and the elderly. Drugs can affect other drugs, such as drugs negating another drug, or it may increase the side effects of another. The more drugs you take increases the likelihood of more side effects. Everyone has their own sensitivity to drugs. Elders may be prone to side effects while others may not be. Some people may only have to take one pill to get rid of an illness, while others might have to take two or more. Then there are adverse effects, and the most common side effect in the elderly is confusion, falls, renal dysfunction, hearing loss, poor vision, and or memory loss. I would use this knowledge as a physical therapist by assessing the situation of an elderly patient's rehabilitation program to suit their needs. In addition, I learned that healthcare providers will deal with many different types of patients, from race, ethnicity, disability, and from various age groups. I will be treating all my patients equally. Drug-on-drug interaction examples. One drug may change the absorption, metabolism, or excretion of another drug. One drug may interact with the mechanics of another drug. Side effects of one drug exacerbate disease, so more of the second drug is needed. Going on to social, cultural, and economic factors, I learned that cost was the number one issue for the elderly because without money or insurance, the elderly may not get their medications. There are elders out in the world who believe their tradition, religion, or beliefs are better than medicine of today, and we as healthcare providers must respect their lifestyle. Finally, you may have to deal with elders who do not speak English, and so a translator is needed. For the two listed on the bottom, I will tell you how I will use this information in my career. I will learn about the patient's culture to show respect and build trust. I will not belittle their cultural beliefs. This will all improve the relationship between the healthcare provider and the patient. Use practical help such as giving elders clear, simple, verbal, and written instructions to help them understand what needs to be done. I will remind them to use memory aids so they don't forget to do what I told them to do as their physical therapist. These memory aids can include calendars, phone reminders, and alarms to remind them. I learned the different types of cares, such as RCAC, which is apartment-style living that requires minimum care for the elderly, CBRF, which is community-based residential facility, SNF, skilled nursing facility, and hospitals. Patients have rights, and when they say no, it means no. You must respect the patient's right, even if it leads to their demise. I'll learn the best thing I can do is try to negotiate or try to take things in small steps because it may change their mind. Unfortunately, I am not able to tell you everything I learned and how I will use it, but these are just some of the things I learned in HS 410 Issues in Aging.